151. What is the most critical side effect to monitor for in a patient receiving ketamine for procedural sedation? Answer: respiratory depression. Rationale: ketamine, a dissociative anesthetic, can cause respiratory depression, though less commonly than other sedatives. Nurses must monitor respiratory rate and oxygen saturation closely to ensure airway safety. 152. What is the priority nursing action for a patient with a serum sodium level of 128 milliequivalents per liter while receiving carbamazepine therapy? Answer: notify the healthcare provider immediately. Rationale: hyponatremia, defined as a serum sodium level less than 135 milliequivalents per liter, is a serious side effect of carbamazepine due to the syndrome of inappropriate antidiuretic hormone secretion. Notifying the healthcare provider ensures evaluation and possible drug discontinuation or fluid restriction. 153. What is the most common side effect of memantine in patients with Alzheimer's disease? Answer: dizziness. Rationale: memantine, an NMDA receptor antagonist, commonly causes dizziness due to CNS effects. Nurses should educate patients to avoid falls and report persistent symptoms. 154. What lab value should be monitored in a patient receiving ethambutol for tuberculosis? Answer: visual acuity and color vision. Rationale: ethambutol can cause optic neuritis, leading to vision loss. Regular monitoring of visual acuity and color discrimination detects early toxicity, prompting discontinuation. 155. What is the primary patient education point for a patient prescribed tadalafil for erectile dysfunction? Answer: seek immediate medical attention for an erection lasting longer than 4 hours. Rationale: tadalafil can cause priapism, a medical emergency. Educating patients to seek prompt care prevents tissue damage and complications. 156. What is the most critical adverse effect of enoxaparin in patients with pulmonary embolism? Answer: bleeding. Rationale: enoxaparin, a low molecular weight heparin, increases bleeding risk. Nurses should monitor for signs like hematuria or melena and educate patients to report unusual bleeding. 157. What is the priority nursing action for a patient experiencing tremors while on lithium? Answer: notify the healthcare provider immediately. Rationale: tremors may indicate lithium toxicity, especially with serum lithium levels greater than 1.5 milliequivalents per liter. Notifying the healthcare provider ensures evaluation of lithium levels and possible dose adjustment. 158. What is the most common side effect of leukotriene modifiers like zafralukist? Answer: headache. Rationale: zafralukist, used for asthma, commonly causes headaches. Nurses should educate patients to report persistent or severe headaches for further evaluation. 159. What is the primary nursing action for a patient with a cyclosporin level of 350 nanograms per milliliter? Answer: hold the cyclosporin dose and notify the healthcare provider. Rationale: a cyclosporin level above 300 ing rounds the patient's understanding of safe medication use. 160. What is the most critical side effect of rituximab in patients with lymphoma? Answer: infusion-related reactions. Rationale: rituximab can cause severe infusion reactions, including fever, chills, or anaphylaxis. Nurses should monitor closely during infusion and have emergency medications ready. 161. What is the primary patient education point for a patient starting glipizide for type 2 diabetes? Answer: take the medication 30 minutes before meals to optimize glucose control. Rationale: glipizide, a sulfonylurea, stimulates insulin release and is most effective when taken before meals to manage postprandial glucose spikes. 162. What lab value should be monitored in a patient receiving amikacin? Answer: serum creatinine. Rationale: amikacin, an aminoglycoside, is nephrotoxic. Monitoring serum creatinine detects early kidney damage, allowing for dose adjustment or alternative therapy. 163. What is the most common side effect of ergotamine in patients with migraines? Answer: nausea. Rationale: ergotamine, a vasoconstrictor, commonly causes nausea due to GI irritation. Administering with antiemetics or food can help manage this side effect. 164. What is the priority nursing action for a patient experiencing thrombocytopenia while on heparin? Answer: discontinue heparin and notify the healthcare provider immediately. Rationale: thrombocytopenia may indicate heparin-induced thrombocytopenia, HIT, a serious complication. Stopping heparin and notifying the provider ensures alternative anticoagulation. 165. What is the most critical adverse effect of long-term phenytoin therapy? Answer: gingival hyperplasia. Rationale: phenytoin can cause overgrowth of gum tissue, especially with long-term use. Nurses should educate patients on oral hygiene and monitor for gum changes. 166. What is the primary patient education point for a patient prescribed dabigatran? Answer: store the medication in its original container to prevent moisture exposure. Rationale: dabigatran, an anticoagulant, is moisture-sensitive and loses efficacy if improperly stored. Proper storage ensures therapeutic effectiveness and reduces bleeding risk. 167. What is the most common side effect of typical antipsychotics like chlorpromazine? Answer: extrapyramidal symptoms, EPS. Rationale: chlorpromazine can cause EPS such as tremors or dystonia due to dopamine blockade. Nurses should monitor for movement disorders and administer anticholinergics if prescribed. 168. What is the priority nursing action for a patient with a levetiracetam level of 50 micrograms per milliliter? Answer: notify the healthcare provider immediately. Rationale: a levetiracetam level above 46 micrograms per milliliter may indicate toxicity, risking sedation or coordination issues. Notifying the provider ensures evaluation and possible dose adjustment. 169. What lab value should be monitored in a patient receiving long-term naproxen therapy? Answer: serum creatinine. Rationale: naproxen, an NSAID, can cause nephrotoxicity with long-term use. Monitoring serum creatinine detects early kidney damage, prompting dose adjustment or discontinuation. 170. What is the most critical side effect of bevacizumab in cancer treatment? Answer: gastrointestinal perforation. Rationale: bevacizumab, a VEGF inhibitor, can cause rare but life-threatening GI perforation. Nurses should monitor for abdominal pain or fever and report symptoms immediately. 171. What is the primary nursing action for a patient experiencing urticaria while on lisinopril? Answer: discontinue lisinopril and notify the healthcare provider immediately. Rationale: urticaria may indicate an allergic reaction to lisinopril, an ACE inhibitor. Stopping the drug and notifying the provider prevents progression to severe reactions like angioedema. 172. What is the most common side effect of carbonic anhydrase inhibitors like acetazolamide? Answer: tingling in extremities. Rationale: acetazolamide can cause paresthesia due to electrolyte shifts. Nurses should educate patients that this is usually benign, but to report persistent symptoms. 173. What is the priority patient education point for a patient starting methotrexate for rheumatoid arthritis? Answer: avoid alcohol to reduce the risk of hepatotoxicity. Rationale: methotrexate is hepatotoxic and alcohol exacerbates liver damage. Educating patients to avoid alcohol helps prevent serious liver complications. 174. What is the most critical adverse effect of albuterol in patients with asthma? Answer: tachycardia. Rationale: albuterol, a beta-2 agonist, can stimulate the heart, causing tachycardia. Nurses should monitor heart rate and educate patients to report palpitations. 175. What lab value should be monitored in a patient receiving mycophenolate? Answer: complete blood count, CBC. Rationale: mycophenolate, an immunosuppressant, can cause bone marrow suppression, leading to leukopenia or anemia. Monitoring CBC detects early hematologic toxicity. 176. What is the primary nursing action for a patient with a phenobarbital level of 45 micrograms per milliliter? Answer: hold the phenobarbital dose and notify the healthcare provider. Rationale: a phenobarbital level above 40 micrograms per milliliter indicates toxicity, risking sedation or respiratory depression. Holding the dose and notifying the provider allows for dose adjustment. 177. What is the most common side effect of bile acid sequestrants like cholestyramine? Answer: constipation. Rationale: cholestyramine binds bile acids, slowing GI motility and causing constipation. Nurses should educate patients on fiber intake and adequate hydration. 178. What is the priority nursing action for a patient experiencing akathisia while on aripiprazole? Answer: notify the healthcare provider immediately. Rationale: akathisia, a restlessness side effect of antipsychotics like aripiprazole, requires prompt provider notification for dose adjustment or adjunctive therapy like beta blockers. 179. What is the most critical side effect of long-term amlodipine therapy? Answer: peripheral edema. Rationale: amlodipine, a calcium channel blocker, causes vasodilation, leading to fluid accumulation in extremities. Nurses should monitor for edema and educate patients to report swelling. 180. What is the primary patient education point for a patient prescribed minocycline? Answer: avoid lying down immediately after taking to prevent esophageal irritation. Rationale: minocycline can cause esophageal irritation or ulceration. Patients should take it with water and remain upright for at least 30 minutes to reduce this risk. 181. What lab value should be monitored in a patient receiving itraconazole? Answer: liver function tests, ALT/AST. Rationale: itraconazole, an antifungal, can cause hepatotoxicity. Monitoring liver enzymes detects early liver damage, prompting dose adjustment or discontinuation. 182. What is the most common side effect of acetylcholinesterase inhibitors like rivastigmine? Answer: nausea. Rationale: rivastigmine, used for dementia, increases acetylcholine, causing GI side effects like nausea. Taking with food can help reduce this side effect. 183. What is the priority nursing action for a patient with a topiramate level of 25 micrograms per milliliter? Answer: hold the topiramate dose and notify the healthcare provider. Rationale: a topiramate level above 20 micrograms per milliliter indicates toxicity, risking cognitive impairment or seizures. Holding the dose and notifying the provider allows for dose adjustment. 184. What is the most critical side effect of vincristine in cancer treatment? Answer: peripheral neuropathy. Rationale: vincristine can cause nerve damage, leading to numbness or weakness. Nurses should monitor for neuropathic symptoms and report them to prevent progression. 185. What is the primary nursing action for a patient experiencing hyperglycemia while on prednisone? Answer: notify the healthcare provider immediately. Rationale: prednisone can cause hyperglycemia, especially in diabetic patients. Notifying the provider ensures glucose monitoring and possible insulin or dose adjustment. 186. What is the most common side effect of SNRIs like venlafaxine? Answer: hypertension. Rationale: venlafaxine can increase blood pressure due to norepinephrine effects. Nurses should monitor blood pressure and educate patients to report headaches or dizziness. 187. What is the priority patient education point for a patient starting exenatide for diabetes? Answer: report severe abdominal pain, which may indicate pancreatitis. Rationale: exenatide, a GLP-1 agonist, can rarely cause pancreatitis. Educating patients to recognize and report symptoms ensures prompt medical intervention. 188. What lab value should be monitored in a patient receiving long-term valproic acid therapy? Answer: platelet count. Rationale: valproic acid can cause thrombocytopenia, increasing bleeding risk. Monitoring platelet counts detects early hematologic toxicity, prompting dose adjustment. 189. What is the most critical side effect of quetiapine in patients with bipolar disorder? Answer: metabolic syndrome. Rationale: quetiapine can cause weight gain, diabetes, and hyperlipidemia. Nurses should monitor weight, glucose, and lipids to manage metabolic risks. 190. What is the primary nursing action for a patient with a tobramycin trough level of 2.5 micrograms per milliliter? Answer: hold the tobramycin dose and notify the healthcare provider. Rationale: A topramycin trough level above 2 micrograms per milliliter indicates toxicity, risking nephrotoxicity or ototoxicity. Holding the dose and notifying the provider allows for dose adjustment. 191. What is the most common side effect of osmotic diuretics like mannitol? Answer: electrolyte imbalances. Rationale: mannitol can cause shifts in electrolytes like sodium or potassium, leading to imbalances. Nurses should monitor electrolyte levels and report abnormalities. 192. What is the priority nursing action for a patient experiencing a rash while on lamotrigine? Answer: discontinue lamotrigine and notify the healthcare provider immediately. Rationale: lamotrigine can cause severe rashes, including Stevens-Johnson syndrome. Stopping the drug and notifying the provider ensures urgent care and evaluation. 193. What is the most critical adverse effect of ciprofloxacin in elderly patients? Answer: tendon rupture. Rationale: ciprofloxacin increases the risk of tendinitis and rupture, especially in older adults. Nurses should educate patients to report tendon pain and avoid strenuous activity. 194. What is the primary patient education point for a patient prescribed budesonide inhaler? Answer: rinse the mouth after use to prevent oral thrush. Rationale: budesonide, an inhaled corticosteroid, can cause oropharyngeal candidiasis. Rinsing the mouth after inhalation reduces this risk. 195. What lab value should be monitored in a patient receiving long-term carbamazepine therapy? Answer: sodium levels. Rationale: carbamazepine can cause hyponatremia due to SIADH. Monitoring sodium levels detects early electrolyte imbalances, prompting dose adjustment or fluid management. 196. What is the most common side effect of calcium channel blockers like diltiazem? Answer: bradycardia. Rationale: diltiazem slows the heart rate by inhibiting calcium entry in cardiac tissue. Nurses should monitor the patient's pulse and hold the dose if bradycardia, defined as a heart rate less than 60 beats per minute, occurs. 197. What is the priority nursing action for a patient with a fentanyl overdose? Answer: administer naloxone and monitor respiratory status. Rationale: fentanyl overdose causes respiratory depression. Naloxone reverses opioid effects and monitoring ensures airway protection and adequate ventilation. 198. What is the most critical side effect of irinotecan in cancer treatment? Answer: severe diarrhea. Rationale: irinotecan can cause life-threatening diarrhea, leading to dehydration or electrolyte imbalances. Nurses should monitor bowel patterns and administer antidiarrheals as prescribed. 199. What is the primary nursing action for a patient experiencing photosensitivity while on doxycycline? Answer: educate the patient to avoid sun exposure and use sunscreen. Rationale: doxycycline causes photosensitivity, increasing sunburn risk. Educating patients to use sunscreen and protective clothing prevents skin damage. 200. What is the most common side effect of H1 receptor blockers like loratadine? Answer: drowsiness, mild. Rationale: loratadine, a second-generation antihistamine, can cause mild drowsiness, though less than first-generation drugs. Patients should be cautioned against driving if affected.